So greetings, friends and followers. This is Nurses Talking. I am Dale Barcy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, it is my great pleasure to welcome Amy Ruff. Amy is a registered nurse. She holds a bachelor's degree from the College of New Jersey and specialty training from the University of Texas MD Anderson Cancer Center. Her nursing career spans many decades and different areas of nursing, from intensive care to home care. She has been adjunct faculty at the County College of Morris and Brandman University and has precepted many nurses in their clinical specialty roles. Currently, Amy is the director of the National Transcendental Meditation for Nurses program, bringing the evidence-based Transcendental Meditation course to nurses. She has coordinated the TM program for nurses in 17 hospitals across the US. She's a presenter at conferences such as the Mayo Clinic, ANCC Magnet, American Holistic Nurses Association, and is a frequent guest on podcasts dealing with the challenges of nurses. She has helped to coordinate 5 nursing research studies. The most recent research on nurses measuring the effects of the TM meditation technique on nurses' well-being is due to be published in January. This was a randomized controlled trial of 104 nurses in 3 Florida Magnet hospitals. She's a member of the American Holistic Nurses Association. As education director for TM for Women, she has obtained continuing education contact hours for nurses, licensed massage therapists, and licensed social workers when they learn the Transcendental Meditation technique. Amy, thank you very much for coming.
Thank you for having me, Dale. It's a pleasure. Thanks.
It is my great pleasure. It is my great pleasure. But firstly, why are you a nurse?
Why am I a nurse? Well, I am one of those nurses who knew when she was 5 that I wanted to be a nurse. There was no question, no other profession would be what I wanted to do. And so
what made you know that, though? I mean, did you come in contact with a nurse?
Actually, yes, I had an auntie who was a nurse, and I remember as a child, seeing her go to work in her white uniform and her polished shoes, and yes, I did look up to her. I did, definitely did. And same with my cousin, who also became a nurse. She was yes.
Okay, awesome. So you wanted this since you were a child, 5. When you got to be a nurse, when you became a nurse, you were looking at your aunt with the starch white uniform and the cap and the shoes and the stockings and whatever, and you got to be a nurse. Was it what you thought?
I was so excited to graduate. I started out in a diploma program, so we had a lot of clinical time. 3 days of clinical, 2 days of classroom. I was so proud. I was so excited to become a nurse. And so my first job, which I don't even think they'll do this anymore, was in the ICU of my community hospital.
Yeah.
I loved it. I looked forward to going to work. I really felt that I was making a difference. I was learning a lot. I had great preceptors, but I did experience a nurse burnout after about a year and a half.
I see. And so what did you do about that?
What did I do about that? Well, I'll tell you how it manifested. It really hit me like a brick. I didn't feel a slow progression as sometimes people do with burnout, but it hit me right away, fairly quickly. And it manifested in a few ways. I was starting to dream about patients at night. I wasn't sleeping well. I was waking up with anxiety about the shift. I was taking on habits after work to deal with stress that were not healthy. And I'll be frank, what it was we either went to the diner at midnight after our shift and just ate and ate and ate and ate, or we went to the bars because nurses need a way to decompress and
Yeah.
The stress that they're feeling. So it wasn't healthy. I knew it wasn't healthy. I knew I needed to do something because I wanted, I wanted to continue. I wanted to have a career. And so it was very fortunate, actually. I wasn't looking for self-care. We didn't talk about self-care back then,
Right.
right?
Right.
72. I don't think the word existed. No awareness of self-care. But so I was very fortunate. I went to a library lecture on the Transcendental Meditation course. And in that lecture, the teachers talked about the research that's been done on TM, the good effects of TM for health and for sleep and for reducing, getting rid of stress from the physiology and fatigue. And I didn't care about the research. I just liked what they said. Yeah, and I went down with a friend a couple of weekends later and started the course. And it turned everything around for me. Because in 20 minutes of sitting in this meditation, which is so easy to do, it's so effortless, it doesn't involve any concentration or trying or forcing the mind. It's not a religion, it's not a philosophy. It allows the mind and the body to settle down to such a deep state of rest in 20 minutes, although we are awake and alert. And EEGs show brainwave coherence and this global brain coherence that happens in the 20 minutes, and the body's resting very deeply. And we know that's how we get rid of stress, is we rest, right?
Yeah. Yeah.
We sleep at night, and that gets rid of some of the fatigue from the day. But this is a deeper quality of rest, and it happens much more quickly than the deep rest and sleep. So stresses are released from the physiology, so that when we come out of 20 minutes, we're very refreshed and we're clear mentally. So that's what I did. I took the course. I just celebrated my 50th anniversary of learning TM last month. It's incredible to think that I would do anything for 50 years. But it works. It works. It saved my career, honestly. And I went on and I had a really great career for 40 years clinically after that.
Yeah, yeah, that's awesome. And as I saw in your bio, you worked in many different areas.
Right.
Okay, so I have two questions. Of all of those areas, one, which was your favorite?
Oh boy, that's hard.
I know.
This is a great thing about nursing is that we can move around
Yes.
and we can
Yes.
learn new specialties. It's very unique in a profession, isn't it? Oh boy, what was my favorite? Oh, I loved everything that I did, but I have to say the last 10 years where I'd gotten certified as an enterostomal nurse was my favorite. Wound
Okay.
ostomy.
Yeah, yeah.
Very interesting.
Okay. Yeah, more power to you. As I was saying to someone the other day, when it comes to wounds and stomas and stuff like that, if I can pass it to someone else, trust me, I will.
Not for everybody.
The other question that I wanted to ask, having done all of this, so you've gone from intensive care all through other stuff to home care and stomas and, subacute, post-acute rehab. What would you like to see change, if anything?
In nursing as a profession?
In nursing as a profession, having done all these other bits of it.
We talk around self-care so much with nurses, but we're really not giving them the tools that they need. And I was just on a webinar this morning where nurses were talking about nurses don't feel they can ask to take a break at work. Nurses feel that they're not a good nurse if they sit down for half an hour on a break.
Yeah.
So they keep plugging along. They're these superheroes, that mentality at work. But in truth, how can we continue to give good care, especially on a long shift, 12, 14 hours?
Yeah.
We're getting tired and we're taking in all this stress and fatigue ourselves during the shift. It's just not sustainable. It's just not. So what I would like to see change is that nurses don't delay their meals and their bathroom breaks, and that nursing administration starts to promote and enforce break times.
Yeah.
so that nurses can feel comfortable to recharge and refresh and go back. And we're working on that nationally to have the TM course be institutionalized, if you will, so that
Yeah.
nurses can take their break, meditate for 20 minutes, have some food, go to
Yes.
the bathroom, and go back to their shift.
Exactly.
Huge difference.
Exactly. Yeah. And I love that you mentioned you brought in administrators into this, because you know our education and the way we innately feel, I think, is that we have to keep going. But also management and administration, and I will include myself in the guilty ones in this group, is that we tend to guilt nurses into doing things. If we are short of staff, we call up a nurse that we know who's off, and she says, I can't do it today. I say, oh, please, can you? And, make them feel, that if they didn't come, we're short, you're letting down your colleagues, you're doing, and guilt people into doing things that they know before they answer the phone that they're really not going to be able to do or do well.
That's right. That's exactly right. It's because we all went into nursing because we want to give, we want to help people, we want to make a difference. It's a giving, loving profession. There's an art to it as
Mhm.
well as a science, and it's very easy to get guilted into overextending ourselves.
Yeah, because no one told us. I mean, many of us went into there at like 18, 19, 20, and no one told us honestly that there was a point where the giving has to come back to you. You have to giving to yourself.
Exactly right. And the thing is, when nurses go home, they start their whole other life,
Oh yeah,
family, children. It's not like it stops at work.
yeah,
So they need to
exactly.
recharge. And what many nurses will do who have taken the courses in these hospitals that we've been teaching in is they will sit in their car in the parking garage at the end of their shift before they commute home and do their
Mhm.
20 minutes of TM because they know once they get home,
Yeah, yeah, yeah.
and then they're
That's a
ready.
whole other thing starting.
That's right.
Yeah, yeah, yeah. And that really is another thing, because very often, when I was a student nurse, way back when,
Me too.
there was something we were not allowed to do. There was something we were not allowed, first of all, as a student nurse, as you mentioned, being a student nurse was like a diploma. You went through a diploma program, and my program was pretty similar. And you wore a uniform and all of that. You were not allowed to wear it on the street.
Right.
And it was only later that I realized just how good that reasoning was. For number one, the rationale that they gave you was people on the street do not know what you can do. If something happens, they expect you to do something and you don't know anything.
Yeah.
That was the rationale that they gave us. Plus, even then they were talking about it being an infection control issue. But the other thing that did, which I didn't even assimilate until much later, is that it allowed you to break. It allowed you to not take that persona, that personality out into the street. You took those clothes off, you whatever, and you went out into the street in your own clothes, which in retrospect was a really good thing.
Very good thing.
It was
Very
a
good
really
thing.
good thing. Mm-hmm.
Mhm.
Yeah. So you talk about transcendental meditation, and you've formulated a program just for nurses. I know you do it for women. Back to that. Why just women?
Well, it's not just for women, it's for everyone. People of
Okay.
all ages, all walks of life, men, women, children, everyone can take the Transcendental Meditation course. Uh,
Yeah.
the TM for Women organization teaches the exact same course as every certified teacher teaches.
Mhm.
Teachers of
Right.
Transcendental Meditation go through a very extensive 5 months in residence to learn to become a TM teacher. Is a very ancient technique, over 6,000
Mhm.
years old, and it needs to be taught in a precise way.
Yeah,
Very easy
anyway.
to learn, very easy to learn. And so the TM organization was inaugurated around 2007, 6 or 7, to do outreaches to women specifically, because women like to be together.
Mhm.
Women like to learn together. And the TM for Nurses organization and outreach was an offshoot of that, because most nurses are women. We love our male nurses. They can learn too. So it's a technique for everyone. In 1958, it was began teaching in the U.S. and over 10 million people have learned the TM technique since then. So it's not leaving anybody out. Everybody can take the course. Everybody can learn. And the TM for Nurses course is the standardized course of Transcendental Meditation, which is 4 consecutive days of about 90 minutes each day. But there are a few follow-up meetings and checking in with them to see how their meditation's going, with topics specific to nurses. And we're an endorsed program of the American Holistic Nurses Association. Nurses can get 23 contact hours when they take the TM for Nurses course. So that's a nice.
Yeah. That took care of your C's for the year.
Yeah, it's a good chunk of CUs. Right.
Yeah. And 17 hospitals. You started this in 17 hospitals. Let me ask you, do they reach out to you? Do you reach out to them?
Both.
So when you're reaching out to them, what kind of reception are you getting?
Actually, very good, because there's such a body of research now. There's over 420 peer-reviewed studies on the good effects of TM for mind and body health, relationships. There's a lot of published research. And now we have 5, soon to be published 6, studies just with nurses. So I think when we can show them this vast group of research studies, that it is evidence-based, that the American Heart Association recommends Transcendental Meditation. That came out after a 5-year study, randomized controlled trial, that showed a 48% reduction in heart attack and stroke in the TM group compared to control.
Yeah.
So the AHA, Heart Association, came out with a statement recommending TM. And the other thing that's very nice is the American Nurses Association, California, chose the TM for Nurses course they looked at all sorts of self-care, chose the TM for Nurses course as one of the top 5 best picks for nurses' mental health and well-being.
Nice.
So there's a good acceptance of it. Projects take time to get rolling.
Yeah.
But there's a good acceptance of it.
That's awesome. So what would you say, if you had to look ahead 10 years, what would you like to see in nursing?
Well, you and I were just talking about this, that we learned about the art and the science of nursing. I'd like to see more of the art and the heart come back into nursing practice. Not to fault the nurses, they're overworked, they have too many patients, the staffing isn't good. They're just doing what they can, to get the job done. But I'd like to see more of that come back into nursing. And this recent study that's going to be published that you mentioned, actually it's going to be in December now.
Okay.
In the Journal of Nursing Administration. One of the things we looked at was conscious awareness, or how present is the nurse at the bedside after learning TM. And this is going to be a very exciting publication. Nurses did report that they were much more, they felt calmer, and they could kind of take a step back and listen more to the patients. And they started to really enjoy that. So I would like to see, what would I like to see in 10 years? I would really like hospital administration to recognize the benefit of this, and to be able to show that sick days are reduced when people do TM call outs, that that retention is better, that nurses stay in their positions, they feel they can continue to go on. And just for nurses to take back their own power, and to advocate for their own self-care. But nursing administration needs to recognize the value of that, so that the nurses are supported to do it at work.
Yeah. And you kind of touched on the question I was just about to ask when you said nursing administration needs to be supportive of that, because they you say they're receptive to you doing it. And so my question was going to be, when you have, let us say, when you're presenting this to a group of nurses or whoever, is administration in it?
Many times.
Many times. And so they're
Okay.
taking the course as well. Okay.
Yeah, many times.
Yeah.
But
That's
change
awesome.
is slow. Change is slow.
I know. It's like molasses.
The first thing is we need to find a way for nurses to just take a break at work.
Yeah. Um, I know. If you had to describe in one word the most essential, what you think is the most essential quality of a nurse, what would that word be?
Compassion.
Compassion. Yeah.
And
Okay.
we can't teach people compassion, right? It has to really come from within.
Mhm.
And I think nurses all start out feeling that
Yeah.
but they just get tired and they get overwhelmed. And so we can measure compassion satisfaction. We have measured it in our studies.
Mhm.
And it's just, it's defined, compassion satisfaction is just defined as, I'm going to read it, the positive feelings that helpers feel as a result of what they do.
Mhm.
Sort of the opposite of compassion fatigue. So we did a study in 2019 that measured compassion satisfaction, showed statistically significant improvements in compassion satisfaction and reductions in burnout and reductions in secondary traumatic stress. And so I think that's the most essential quality of a nurse.
Yes.
Toward another. Yeah.
Yeah. I get that word a lot. And somehow we all recognize that, intrinsically they're compassionate. It doesn't always show, but intrinsically we are.
We are. I think that's why we became nurses.
Yeah. Yeah. Indeed. So what would you say? You have been a nurse for decades in many different areas, and still doing your thing. What would you say is your greatest achievement so far? And notice I said so far.
Because we're aging without limits.
There you go.
Oh, my greatest achievement so far. I think just being able to continue in the profession after I learned Transcendental Meditation, just being able to continue in the profession for nearly 40 more years and enjoy it and feel satisfied at the end of the day, without putting my own health at risk. Because as I said, that rest that you get in 20 minutes allows fatigue to just flow out. It releases stress. You're able to bounce back and go into activity. It's, the word meditation is tricky because people have all sorts of connotations about what meditation is. What are you staring at a candle flame? Are you concentrating on your breath? TM is so completely different from that. It's just effortless. It's effortless. We look forward to doing it. And it's a preparation for activity. We're not just meditating for the sake of meditation. We look forward to it, but we're really meditating for good effects in activity, more clear thinking, more energy, more happiness within, all those expansion of awareness, expansion of consciousness that come with regular practice. So it's really to make it. So what was your question? What was my greatest accomplishment? I think just being able to stay in nursing.
That's really huge when you think about it and you look back at all of these things. That really is huge, and the changes that have taken place and all of those things to stay the course is good.
Yeah,
it's good. Amy, before we go, any little gem you'd like to leave us with? Any little gem? Any last words you'd like to leave us with?
Well, the little takeaway should be to take care of yourself first. Attend to your own inner health, your inner well-being, your stress, your fatigue. Attend to yourself first, because it will make everything better. It will make your patient care better. Your patients will feel that. You'll be able to stay in nursing. It's so challenging these days to stay in nursing.
It is. It is.
So I think that's it. You know, the cliche, put your own oxygen mask on first. That's my gem. That's what nurses need to do.
That's what we need to do. That's what we need to do. Amy, thank you so very, very much for this conversation.
Thank you.
Maybe actually, I have to tell you that talking to you is in itself calming. So thank you.
Well, that's good. May I leave our website for anybody?
Absolutely. Absolutely.
We have a very nice website with all the information about the continuing education and everything. It's www.tm-nurses.org.
Okay. Thank you, Amy. And I will put that in the description box also for anyone who missed it.
Okay.
So thank you very much.
Thank you, Dale. Thank you. Thank you for all you're doing.
My pleasure. It's my pleasure.